The March-April 2014 issue of CardioSource WorldNews Interventions has a wonderful cover story on radiation safety in the cath lab. Now, this was triggered somewhat by some new recommendations out of Europe, as well as some rather interesting, shall we say, and somewhat red flag raising research that's recently been published. But besides that, you have to read the cover story for that. Deborah Beck did an excellent job writing the thing. We have a conversation I want to have right now with someone who has, it's an interesting topic for her and one she feels passionately about. Roxana Mehran, MD, Mount Sinai Hospital and School of Medicine, Professor of Medicine and Professor of Health Evidence and Policy there. In this day and age when we have so much new technology, protocols, algorithms, is this really still an issue in terms of radiation in the cath lab?
Well, I can tell you it's a huge issue. As a female interventional cardiologist, it's central to what we think about, especially as we're all training during our childbearing ages, and so therefore it's an extremely important and central issue. And it's not just about radiation per se, it's also about protection against radiation, which then creates all these cath lab related occupational hazards, back pains, varicose veins, all kinds of things. But most importantly, obviously, is the effect of long-term radiation on the operator, and not just the operator, but the healthcare providers.
Absolutely. Now, one of the stories we tell, Deborah tells in the cover story, is an interventionalist saying, you know, I don't really worry about it. I take my badge off and it never appears to have a whole lot of, not a big issue. And he proceeds to say, you know, I don't always wear my badge in the cath lab. There's kind of a lackadaisical view by some people. Yeah. How widespread is that and how big of a problem is that?
I think it's a hugely and widespread issue. I think that most of us, you don't feel radiation, so most of us are feeling oblivious to it. Every hospital has important guidelines that I'm sure that many of the radiation physicists are following. That's why there are badges every month that you're supposed to wear in and outside of your lead. Unfortunately, most interventionalists are ignoring this, and for whatever reason, we feel maybe that we're untouchable, you know.
Well, it's the 21st century. Is it still a problem? That may be part of the issue.
I think there's been huge improvements in imaging technologies, but still, radiation is radiation. Radiation dose is the dose that you're receiving, and over time is cumulative. And so therefore it's important to know at least how much you're being exposed to, and the way you figure that out is by wearing your badge. And unfortunately, a good majority of the physicians are not doing that. So if this article does anything but to at least bring that to fruition, that you should, you absolutely should, for your own protection, know how much radiation you're being exposed to. It's an extremely important step.
Mount Sinai is a state-of-the-art facility. You do some great interventional videos for us that are online at ACC. What are you doing specifically that you would recommend? If you're not doing it at your facility, you should.
I think all operators should take all kinds of precautions in making sure that at all times, not only just that they wear their lead, but that they also have glasses as well as thyroid shield. We wear the badges all the time. We have radiation physicists that give us the badges on a monthly basis. It's recorded. We know what we're getting every month. So those are really important steps. But in the lab, you try to do as much as possible to reduce the radiation dose. Also to the patient in these complex procedures, it's important to change the angulation. It's important to see where the tube is, make sure that all of the protective wear is there on each and every one of the labs before you enter, before you start your procedure, because once the procedure starts, that's all you're thinking about.
That's true. And there's also the opportunity that, you know, you start doing something and you're doing it really well, but over time you just kind of get a little bit lazy. You're not going to do it quite right this time. And this is just a reminder to go back to the beginning, make sure everything is in place, and then make sure it stays in place.
That's exactly right. And to follow a certain routine that you don't make shortcuts to. And do go to the courses that talk about how to reduce the radiation exposure. It's not about right next to the tube. A lot of it is the scatter radiation. So therefore, there are so many good tools now to minimize that, and that's really what we need to do.
And please, online at CardioSource World News, you will have a chance to read the article. You probably should be getting it in your mail pretty soon if you don't have it already. Check out the story by Deborah Beck. It is wonderful. For CardioSource World News Interventions, I'm Rick McGuire, Executive Editor.